thank you all very much for joining today. This is going to be the EPAP Live, the European Patient Ambassador Programme. And today we're going to be talking about how to prepare as a patient representative to get involved in a healthcare conference. So for those who don't know me, slides are frozen. So my name is Courtney Coleman. I'm part of the patient involvement team here at the European Lung Foundation. My role is to get people with lung conditions, family members, carers, and people living with lung conditions involved in research and in clinical practice. And as part of that, I help to organise patient involvement in the European Respiratory Society's annual conference. That's a huge event. There's normally about 20,000 people. And I know many of you will have already attended that event. And part of our job is to make sure that we're bringing patient and real world lived experience along with sort of the clinical and scientific updates, and to really bring that to life and connect people with lived experience with the research community. So I'm very pleased to have been asked to chair today's session, and I'm joined by some fantastic speakers who are also going to talk and share their experience of coming along to conferences. We have an international audience, as always, for these events. So firstly, if you would like to follow along with translation with closed captions, you should be able to do that if you go to the bar at the bottom normally of your screen and click on the arrow next to the captions, then you'll be able to select the captions option. If you're not seeing it, you might need to exit this meeting, not exit the meeting, but just go to a different tab on your computer or your phone and sign into your Zoom account. And then within there, if you go to the settings and the meeting tab, you will be able to turn on the captions for your own device. So yeah, do follow along with captions if that would be helpful. Just bear in mind, it is an AI translation, so we know it won't be perfect, but hopefully it will allow you to follow on a little bit more easily. So today's programme, today we're going to talk about patients at healthcare conferences, EPAP live events. We have organised these generally to make sure that we're offering people with lived experience, patients, family members, the tools and knowledge that they need to represent themselves and to represent their lung conditions to different audiences, with the idea that it will help to improve access to care and will help to, sorry, someone's just popped something up my screen. I'm going to save that. And it will allow you to get the most out of attending these sorts of events. So we're going to look at kind of the role that patients can play, how to maybe prepare a little bit in advance, what are some of the top tips and tricks, and also from the perspective of a researcher, why do they really value having patients involved in healthcare conferences? So we're going to hear from three brilliant speakers. Susanna will bring the researcher perspective, then Hilary will talk about her experience as an individual patient, and Jean-Michel will talk about his perspective from someone who has a lung condition but also runs a patient organisation. We'll then talk a little bit briefly about patients at the ERS Congress that's coming up in September. So for anyone who's thinking about coming along and might want to help prepare for that, we'll share some information, and then we'll have time for some questions from you at the end. So yeah, really looking forward to that. Just a few housekeeping notes. So this is a meeting format, so there should be a chat box. You can see, again, if you go to the bottom of your screen, you can add your comments and your questions for the speakers into the chat box. Later on, when we do the question and answer, if you would like to ask your question live, then you can raise your hand and I'll come to you. So, and you can find that through the more section sometimes or in the reactions. In terms of other housekeeping, I just ask you to keep yourself on mute while each of the speakers is talking, and we'll share our video and obviously our audio, but you can feel free to share your video if you would like, or you might want to put it on just at the end for the question and answer. Feel free, if you are on social media, you can tag European Lung Foundation and the European Respiratory Society in your posts, and yeah, tell people that you're here today. After the event, we will record all of the talks, and those will be available on the ELF website. And for those who have registered, you'll also get shared by email. And then finally, we obviously want to hear from you and, hear from your experiences as well. And we will use a couple of polls during the event just to kind of check who we have here today and what kind of experiences you bring with us. So I'm going to ask Ellie if she can share the first poll now. That should pop up on your screen. So feel free to pop your answers. Down, there's a couple of questions. What country you're joining from, what kind of perspective you bring as a patient, as a professional, your gender, and then how well you kind of understand the role of patients who are getting involved in conferences. So you might need to scroll down to see all of the questions. I can see the answers coming in. So just give you a couple more minutes. Right. Feel free to scroll down if you need to answer all the different questions. According to this, everyone here is female today. Or maybe they're just the ones who've done the poll. All right. Okay, I think that's probably great. Yeah, I think we can end that. Perfect, thank you very much. And right, I think we are ready now to go to our first speaker. So I'm very pleased to introduce Dr. Susanna Pfeiffer. Susanna is a researcher at the Amsterdam University Medical Center. She's part of the Department of Pediatric Pulmonology and Pulmonary Medicine and is based in the Netherlands. Susanna is a respiratory researcher and clinical epidemiologist, specialising in respiratory outcomes in children and adults. She's really involved in the European Respiratory Society as an early career member, representing Assembly 6, which is paediatrics, and has also served as the chair of the Young Researchers Board of the Netherlands Respiratory Society. Susanna is really passionate about patient and public involvement in research, and she has experience establishing patient advisory boards, and is dedicated to translating research into policy and intervention that advance health equity and improve respiratory care. So I'm delighted to have Susanna here, and she is going to share a little bit about her experience of coming to conferences and having patients involved. So I will ask Susanna to share her slides.
Thank you so much for this great introduction, Courtney, and it's been a real pleasure to be the opportunity to be here today. Let me see if I can share it now. Hopefully you can see the screen in full mode, just checking. Yes. So again, thank you all for joining today during this very important webinar. So I'm very pleased to be here. You already heard quite a lot. Oh, let me see if I can go to the next slides. Oh, yes, so that's good. I went too quickly. Yes, so who am I? Courtney already gave a very nice introduction. I was trained as a basic researcher, so more laboratory based. So here you can see an old picture of me in the lab, working on cells and pipettes and understanding how disease works. And then during my career, I'm currently an assistant professor. I moved more to clinical research, working with patients and also supervising PhD students. So this is actually Joni van Dijk on the other picture with a patient, and the patient has consented because it's my daughter, in which we were collecting exhaled breath samples. So one of the interests that we have is assessing how inflammation in the lungs is reflected in exhaled breath. And I'm based in Amsterdam, but I live in Utrecht. Next slide. Yes. Yes. So as a researcher, I've been on various congresses, with ERS always being one of the highlights. I think it's always a very fascinating congress with so many people from very different backgrounds. And it's always a pleasure to be there. But still, even as a plenary speaker or as a chair, it's always also from a researcher quite exciting. I always get a bit nervous when talking to large crowds, even though I really like to do it as well. But it's good to understand also for when you're in the audience that also these researchers, even the big players, as we would say, can be still nervous to be standing in front of a very big crowd. So why do congresses need patient ambassadors? I think one of the most important answers there is that patients and uh, uh, caregivers or family members really bring context to data. As researchers, we're very much trained to understand data that we collect from samples, from clinical data, from large cohort studies, for example. But to understand what they mean and how we can translate those data into impact, we really need the context. And patients can provide that context. So why are lived experiences relevant? For example, to understand which research questions are most important. As researchers, we often write grants, for example, to obtain funding to perform research, but it's very important for us to understand which research questions are now most relevant for patients, can have the most impact. But also, when considering outcomes, it's important that patients think along on what are the outcomes that are most relevant to study. For example, quality of life might be more relevant for a patient with asthma than lung function. But also to understand the burden of measurements. When we do studies, we, for example, collect samples for patients, and it's good for us to understand what is feasible. When does a patient want to participate, and when is it just too much? Or how can we optimize study procedures? But also thinking in dissemination of findings, how can we go to other platforms besides scientific journals? Of course, researchers always like scientific journals, but that's really about informing the scientific community. While of course we'd like to make impact in the real world, which also means that we need to identify channels of communications other than scientific journals. And in the end, I think we all together would like to make impact. We would like to change the lives of patients, but we can only do that together. So one of the examples from my own home institution is that we have a patient advisory board. And in this patient advisory board, we discuss with patients about ongoing studies. And this is a picture from one of our meetings in which we discuss a new tool that we're working on. And we discussed with the patient, so what do you think about this tool? Would you use it? Where should it then be placed if we place it at a home? What would work or what not? So we really need the inputs because we can't think about this all ourselves. We also hosted a youth advisory board in which we discuss, okay, what is important for children? Because of course we know that adults are not, or that children are not young adults. So we need to understand what really is important for children. We discussed with them, for example, the patient information leaflets. Are they understandable? And often they just say, okay, if I trust the doctor, I will sign wherever you want me to sign. But of course, that's not informed consent. So how can we make sure that we provide information to also children that they understand whether they would like to participate in a study or not? And one of the things that we also took forward was studying fatigue. Fatigue was one of the study outcomes really highlighted by the Dutch Lung Foundation as a very important study outcome for patients. However, for researchers, it's often quite a complicated study measure to assess, and they often prefer more objective measures such as lung function. And this is really one of the first studies in which we assessed fatigue and the burden of fatigue in children with severe pediatric asthma, because we knew how important this was for patients. So it really shows that the importance of working together to really make sure that we're studying that what is important for patients. So tips for congresses from my point of view as a researcher. Even for me, congress, especially the large ones, can be very overwhelming. So be aware of that. I always have to think about where do I go when there's large distances at the large conferences. So take your time and energy for preparing for that. It's quite an impact, and I need some time to recover for it, even as a non-patient. It's good to realize that the audience is very diverse. So you might think that there's all clinicians, but there's actually a wide variety of people there. There might be clinicians, but also other healthcare providers. There might be basic scientists that are not so known of working with patients, or they might not be easy to interact with patients. There might be students and more experienced people. So there can be a very broad audience there. So always check when you talk to someone, who are they? What is their backgrounds? Are they used to working with patients or not? Don't be scared to use the microphone. Even for me and my students, it's always, especially in the big rooms, quite scary to use the microphone. Just go for it. I think the most scary parts to be on stand is having no questions. So go there, ask questions. It's good to start with your name and organization, because that's something, the only thing that you will capture as a speaker. So say that you're a patient representative on behalf of a certain organization, so they can always find you back in the end afterwards, for example. And think about other sessions beside the plenary sessions. So often congresses have various sessions that can be plenary in a room, but also poster sessions are great sessions to interact, because poster sessions are often the more junior researchers or the researchers that are doing a PhD. They're very eager to talk. So please go there and talk to them. And then a last remark concerning smaller or bigger health conferences. You've got the large conferences such as ERS, Annual Congress, ATS, but also think about national meetings or focused meetings. There's, I think, a preference for both of them. It might be easier to interact at a smaller meeting, but they might have more talks at a large meeting. But it might be good to think about what works for you. Where do you want to talk to? What kind of people? Should they be from a national point of view or international? So those are things to consider. And then last but definitely not least, you are an equal partner. Realize that, like, you are very important for researchers to understand lived experiences, to bring context to data. So don't put yourself down. You are very important there. And I really hope to see everyone at the next conference. So hopefully at ERS. Thank you so much.
Thank you so much, Susanna. That was brilliant, and I think really highlights from a different perspective than I guess we often would come at, in terms of how, yeah, from that kind of professional perspective of where you feel that it's important to have patients involved and kind of what they bring to the table. So thank you very much. Any questions that you have for Susanna, do pop them in the chat, and we'll have the question and answer panel at the end. I am now very, very pleased to introduce Hilary Hodge. So Hilary is an American living in France. And Hilary is a severe asthma patient, and is the co-chair of SHARP, which is a huge Europe-wide clinical collaboration between patients, researchers, and clinicians. And Hilary is the patient co-chair of that project. And has also attended lots of different healthcare conferences and events as part of that role and beyond. She often speaks at those sorts of events to researchers and clinicians from the patient's perspective. So I'm very pleased to hand over to Hilary, and yeah, she's going to talk to us a little bit about her experience of attending conferences as a patient.
Thank you, Courtney. All right, I'm going to share my screen. Can you see that? It's working? Okay,
Yeah, we can see it.
great. Thank you. Okay, so as Courtney said, thank you, Courtney, for that very kind introduction.
You might need to put it on presentation
Oh,
mode.
it's
We can
not.
see
Okay,
the,
let's see.
sorry.
No, 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 that's good. How's this?
Perfect, brilliant.
Okay.
Thank you.
Okay, so thank you, Courtney, for that intro. As Courtney said, I have severe asthma. I've had it since I was 8. And because of being on prednisone so much, I also developed adrenal insufficiency when I was 39. So some of you on here might have that as well. That's a common comorbidity, I know. Since last year, I've been the patient chair of SHARP, exactly like Courtney said, which is the severe arm of ERS. And as patient chair, I've already attended 6 conferences with SHARP. Some are tiny, some are big, but I'm always there as the patient to provide the patient point of view. And I'm excited to say that I'm working with Courtney to help plan a severe asthma online summit for, we're hoping 700 plus people through the European Lung Foundation this coming November. And I say that to also emphasize that not all conferences are in person. So I'm going to talk just a little bit about 8 tips for before, during, and after a conference to help you make the most of it, especially if it's your first time going to one. So beforehand, some things that you can do are to look at the schedule online and start to think about what sessions are interesting, and then taking a look at the map to see how close they are. Because Susanna touched on this, but in Vienna and in Milan, which were the last 2 ERS locations, those conference centers can be 3 kilometers long. It's incredible. It can take 40 minutes to walk between sessions. So I like to try to find ones that are close together and just stay there all day, even if it means I'm missing ones that I would like to go to just for practicality. Some of you might have to be in a wheelchair. Some of you might have an oxygen tank. So there's also just accommodations to consider. Um, and then as you look at the sessions, you can also start to brainstorm questions ahead of time. That will help you think about the right sessions and also get ideas for what you can ask during the question and answer part. Some ideas might be, what new treatments for my condition are on the horizon, what new research is being done for my condition, how can I get involved with advocacy, and that can help you choose which ones. Now there are sessions in a big, sometimes there's sessions with, I'm talking about ERS right now. Sometimes there are sessions with 50 people, sometimes there are sessions with 500 people, but there are also poster sessions, which are very cool, which happen all day long. And it's just researchers with their paper, and you can talk to them one-on-one. So you can also try to mix together different types of sessions. Um, so during the conference, remember that you are the expert. You might not know all the medical jargon, but you're the one who's actually living with the condition. And so you actually know more about it than anyone there, even if they've studied it a lot for years, for decades. And so that's why your insight is so invaluable. Your presence and your stories keep everyone on the same page that these are real patients with real stories. Like Susanna said, um, a lot of the time, the people in the audience are clinicians and researchers who very rarely work with patients. So your presence is truly invaluable. And in terms of not knowing the medical jargon, I say that also from personal experience. I went to a conference in Copenhagen last year, a severe asthma conference, and I was just so impressed and intimidated by how brilliant all the researchers and clinicians were. And I was speaking on a panel at the end of the conference, and I think I wanted to prove that patients can follow everything. I felt this pressure to show as a patient, we understand exactly what, like we can use all the words, we really do understand our condition. But I think because I was in front of 200 doctors, I got a little tongue-tied trying to use all the right words. And I realized I learned personally from that I just need to focus when I go to these meetings on just being a patient and sharing my point of view, my frustrations, the things I wish doctors knew. And so, you might have a different experience, but for me personally, I try to not get bogged down in using the jargon and the terminology and trying to prove that I can understand it, and instead just talk about why I'm there, what's difficult for me, and so on. In that same vein, Susanna had the nice picture of the microphone. It can be intimidating to get up and talk at the Q&A part, but try not to be intimidated, especially if you have your questions ahead of time. You can just read them. Again, it's so important for those questions to not only be researchers and clinicians, but patients asking questions like, if we're talking about new medications, are they going to be affordable? What kind of policy can we support to make sure they're available? If we're talking about advocacy, how do patients play a part in that? What can we do? So try not to be intimidated by the Q&A. Number 5 seems obvious, but it's important to say, be gentle on yourself. Don't forget to take breaks, eat snacks, have some water, sit down for a few minutes. And it's okay to skip sessions, even if you really wanted to attend them. They can be totally overwhelming for everyone. Like Susanna said, even the most able-bodied can be completely exhausted by these things. So, number 6, these conferences are a great way to connect with experts. If you'd like to get more involved with advocacy, clinical trials, maybe for new medications, research, it's just a great way to walk around and introduce yourself. If you have business cards, you can give those out, to find foundations that specialize in your condition. It's a fantastic way to just meet the people doing the work. So that's during the conference. The final piece is after the conference. If you did get anyone's contact information, to follow up, to make sure you stay connected, find them on LinkedIn, and consider writing about it. It's a great way to put yourself out there as an advocate, and also to shine a spotlight on the conference and the great work it's doing. You could do it something as simple as a little post on LinkedIn or Instagram. If you work with a foundation, you could reach out. If you would like to work with a foundation, you can offer to write a blog post. So those are just some ideas for what to do after the conference. A few final thoughts. As I've said, remember, not all conferences are in person. Many are virtual, which is easier for a lot of us. And your participation is fantastic in those too, like today. Many people attending the conferences, I already said this, but I'm going to hit on it one more time, both virtual and in person, might only rarely see or work with patients. So when you go there, you remind everybody of why they're there, that it's not just petri dishes or data, but you are real people, doing your best to live a life with a condition that can be sometimes very unpredictable and debilitating. And reminding people of that is incredibly valuable. My final point is, if you're invited to speak on a panel, you might want to think about what could be difficult to talk about. It might be your family. It might be a difficult hospitalization. And you might want to consider practicing talking that through with family members or friends, because, and again, I can just share from personal experience, I did cry during one of my panels. I did not expect to, and it kind of caught me off guard. I'm usually pretty good in groups. And I wished I had practiced with my husband or with somebody before I'd gone on. And now I know that when I talk about the really personal effects that the illness has on me, I need to practice a little bit to avoid getting choked up. Now, at the same time, it's not the worst thing to cry. One of the doctors shared with me afterwards that it made her cry too, and it just reminded her again of this patient point of view. But in my particular case, I wished that I had practiced a little bit more. So those are my thoughts. If you have any other questions, you can share them in the chat. And thank you.
Great. Thank you so much, Hilary. And thank you I think especially that final point, you know, it can be really difficult, can't it? When you are thinking about, yeah, kind of what those boundaries are, and it can be a very personal thing, sharing that your own experience. So yeah, thank you. I appreciate that. I've lost the slides now, so I don't know where Jean-Michel has this lovely picture has disappeared. So let's see if I can find it so that I can introduce our speaker. Yes, no, completely vanished. Are you able to help me out, Ellie?
Don't you to share?
Yeah, slide. Wonderful. Can we go back to the Jean-Michel one? Cool. So I am finally also very pleased to introduce Jean-Michel Fourier. So Jean-Michel is a patient with idiopathic pulmonary fibrosis. And Jean-Michel is also the president of the French Pulmonary Fibrosis Patient Association, AFPF. He lives in France, and he has also been involved in chairing the mental health working group here at the European Lung Foundation. Jean-Michel has attended lots of different healthcare conferences, the ERS, European Respiratory Society Congress, but also others more related to his particular lung condition. And he's going to talk kind of about his experience of straddling both being an individual patient, but also being at a health conference and representing your patient organisation and your association, and kind of how to get the most out of that. So I'm very happy to hand over to Jean-Michel. It's just loading up. Thanks, Jean-Michel.
Okay. Just tell me when it is okay.
Yeah, we can see it. You just need to put it on the presentation mode. Yeah. Brilliant. Thanks.
Yeah. Thank you, Courtney, and hello, everyone. So I want to try to share some practical tips, in fact, about my experience as patient representative, and but as speaker during congresses. So having a patient representative participating at health conferences is very important for several reasons, but most of them have already been touched by Susanna and Hilary. So I will go very quickly about these ones. The main point for me is that it is important to ensure that our patient voice is heard. So as a representative, we can share live experiences, priorities, and concerns that professionals may overlook, like access to care, emotional burden, and daily struggle. So for me, this is the main reason. But the other side of the coin is that it is also good for us. It is empowering us by listening scientists to scientists and healthcare professionals. It's if we are the expert of the life with the disease, with the conditions, they are the experts of the disease. So we can learn a lot from them, and it is also a great opportunity to expand our network. So in detail, how can we prepare ourselves to engage effectively? The first step for me is really to look at to research the conference topics and speakers of your session you are participating, because knowing who and what will be discussed will help you to deliver your message to the audience. The second point is really, and very important, is to clarify for yourself before what you want to achieve, because are you there to raise awareness, to share a live experience, to advocate for change, or to ask a specific question? So prepare only 2 or 3 key messages or talking points that reflect your priorities and the patient community's needs. no more. Stay focused and on these 2 or 3 points. My first advice will be to be familiarized with yourself with basic medical or policy terms relevant to the conference or the sessions. This will help you to understand discussions and contributing effectively. And this will also strengthen your credibility from the scientist and the professional audience. First point is not easy, but really is trying to combine personal stories with facts or data. For example, patient survey results or published research. It is again a way to strengthen your credibility. And this mixed approach speaks a lot to professionals. And it is also a sign of respect for their usual way of thinking. And my last guidance to prepare is to stay focused and respectful, even when your perspective differs from the professionals. Professionals who may be more receptive if you build your input around shared goals. Practice also active listening during the sessions so you can respond and adapt your message to the flow of the conversation and presentation. A good tip, for example, is to last minute to refer in your speech to something that previous speakers have mentioned. And don't underestimate this preparation. When you come prepared, you don't just attend to the conference or the session. You are there to co-create the solutions and help to steering conversations towards more human-centered and effective care. So your presence in that case become not just symbolic, but strategic. And believe me, if you do that, you will be invited again. So how to shift from science to real world patient challenges. So try to ground your perspective in everyday, each day realities, in daily struggles. Don't use too much medical symptoms, but practical issues. For example, with my pulmonary fibrosis, I will never talk about dyspnea, which is the right medical term, but I will talk about my difficulty climbing up 15 stairs without resting, or my difficulty of getting a pack of mineral water out of the boot of my car. And use stories like that to highlight how real life is affected by your condition. These stories are really more powerful and often unforgettable for people attending. And also try to illustrate each story with, if you can, with a suggestion for improvement to keep the conversation solution oriented. Another tip is really to be careful not to speak only about yourself. You are there as a patient representative. So link it to experience by others in the community. This is reinforcing that these are systemic issues and not only isolated incidents for you. And insist on that because, for example, when you are talking about yourself, mention, for example, that something like this is not just my experience. Many others in my support group or in my patient organization are facing the same challenge. If you can, try to talk before with other patient representatives to amplify shared concern, an united voice. Even if it comes from different diseases, has much more impact than your unique voice. And at the end, push for actionable takeaways. Don't just pick. Ask for commitments, ask for improvements, and you can, for example, offer, for example, help to your help for joint working groups about some topics. Our role in these conferences is really to put faces and lives behind the numbers, and don't hesitate to speak from the heart, stay authentic, and back to Hilary's point, if emotions sometimes run high, don't push them away. For example, just last Saturday, I was participating to a live panel discussion in a national event. This discussion was on death and palliative care, and I was myself shedding a few tears during the panel. But this was not an issue, in fact, and the audience was completely silent and engaged with the discussion. So push them away. Professionals often respond strongly to these sincere experiences, and because they are highlighting the real world implication of their work. So let me finish now with a few tips for if you are using a PowerPoint presentation to make it impactful. So first tip is really to start with a strong and personal opening. If you start with a short, powerful story or moment that captures daily reality, the aim of that is really to emotionally engage again your audience in the first 30 seconds, and people remember stories much more than statistics. Be clear and focused. Stick to the 2 or 3 key messages I was mentioning before. Don't try to cover everything. Focus on the main issues and that you want the audience to remember. Use simple language, powerful language, avoid jargon. This makes your message more accessible, and if you can use short sentences with strong verbs to have more impact. We wait, we worry, we need, we suffer, things like that. And if you are using slide, limit text. Use 1 key quote, 1 image or 1 statistic per slide only. Choose visuals that evoke emotion or are representing real life, not just data. And don't try to sound like the professional who they are always showing a lot of figures and diagram on their slide. Don't try to sound like them. And finally end with a call to action if you can, but be clear about what you want the audience to do next. And for example, you can have some message like include, depending of the topic, but include patients earlier in the clinical trial design. Let's co-create a solution together. And finally, leave a strong message and with a quote, an image or a phrase that people will remember and take with them. And to conclude, your voice matters. So you don't need a medical degree to be an expert. Your life experience is expertise. So speak with courage. Share what others can't see, and help professionals to stay connected to the people behind the disease and the policies. So now it's in your hands. So let's go. Your voice can change the discussion. Just get started. Thank you.
Thank you so much, Jean-Michel. That was brilliant. Thank you for sharing your experiences. I've written down a little quote: your participation becomes not just symbolic, but strategic. And I think that's really what it's about, isn't it? If you have the preparation and are very conscious about how you approach it, it can really change your participation from just being a tick box sometimes to really actually helping you achieve your aims as a patient, as an individual patient, but also as an association. So thank you for that. We're now going to very briefly go to my colleague Ellie, who is sitting beside me in our office. She is going to quickly talk a little bit about patient participation in the ERS Congress. It's coming up this year in September. So Ellie's going to talk a little bit about how patients are involved and some things that you can already get involved in. So over to you, Ellie. And do keep putting your questions for Hilary, Susanna and Jean-Michel in the chat.
Right. Hello. Hopefully you can hear me. My name is Ellie and I'm a member of the patient input team here at ELF. The ELF team just wanted to let you know a little bit about the ERS Congress and ways patients get involved. So the ERS Congress is an annual event that brings together the world's respiratory experts to showcase all the latest advances in respiratory medicine and science. The ERS Congress 2025 will take place from the 27th of September to the 1st of October in Amsterdam, Netherlands, and it's also online. The official theme for this year is respiratory health around the globe. Patients and patient organisations can get involved in a number of ways. Oh, why isn't it going forward? Do something. Here we go. So the first way is the patient input team and the ELF team. We work with a group of patient organisation representatives to organise a patient organisation networking day. And this is live at the ERS Congress in Amsterdam in person, but you can also join online. And this event brings together over 100 patients and patient organisation representatives to discuss important topics on lung health. This year's theme is improving respiratory health, thinking globally, acting locally. And we will have talks on key issues in respiratory health, interactive discussions to share insights and strategies, and peer-to-peer networking to foster collaboration and learning. And you can find out more about Patient Organisation Day. I think Jeanette's going to pop the link in the chat if you want to find out more. And then other ways, there will be a number of patients speaking at Congress this year. There will be pre-recorded videos included in some scientific sessions with patients answering Q&A live in person or joining the session online. There will also be a few live patient speakers in scientific sessions, such as in the LAM Symposium. And new for this year, there will be 4 patient-centered studio sessions. And the topics of these sessions were chosen by PAG members, and they are mental health, pulmonary rehabilitation, communication between patients and healthcare professionals, and caregivers. And in these sessions, patients will be in conversation with healthcare professionals about these important topics. And on Wednesday, we have special sessions which will also feature patients as speakers and as chairs. And there will be one on patient involvement in innovation and another on prevention. And then there are other ways, also not just speakers, there'll be a daily networking in the community space, and PAG members and patient organisation representatives will also join ERS task force and clinical research collaboration meetings, which are held at the Congress. There are still ways to get involved this year. If you are interested in sharing a project or an experience at Patient Organisation Networking Day, there is a short form to complete, and I think Jeanette's going to put that in the chat. And registration is still open for the Congress, and ELF do provide bursaries, and I think the links for those will also go into the chat. So yeah, you can also finally, Lucy won't forgive me if I forget this one, you can also submit an entry as part of the Global Voices campaign. So the Global Voices campaign is a joint ERS and ELF campaign to give patients an opportunity to share their realities and experiences. It will connect healthcare professionals with the realities of living with a lung condition. You can enter an image and a quote to be part of the campaign, and these will be displayed around the conference centre during the Congress. A link to take part will be in the chat, and it will be really great if you could share this with your networks and consider entering yourself if you haven't already. And that's it from me. Thank you.
Brilliant. Thank you, Ellie. Thank you so much. And yeah, would really encourage everyone to take part in the Global Voices campaign, register for Congress if you haven't already. The campaign, we're trying to have ambitiously a patient representative from all corners of the globe. So if you know anyone who might be interested in sharing their experience through an image and a short quote, that would be fantastic.